And we're talking about two different milestones this week, and one grim one, the 3 million global deaths I mentioned, but also a more positive one, the U.S. now having half of American adults receiving at least one dose of the vaccine. What do these two milestones tell us about the state of the pandemic now?
Well, you really can see them, although obviously they're not related in any formal way, as very sort of, well, I'll say related data points here. It shows that, the burden of death basically is going to be increasingly shifting to poorer countries. Brazil, India, Mexico, Turkey today hit a record for deaths. And that brings us to the second data point, which is that, why is that? It's, partly because the U.S., which has suffered a tremendous death toll, the most in the world, that's really gone down, and largely because of vaccines. I mean, you have a rate where, 50% of Americans, adult Americans, now have had at least one dose of vaccine, and we've seen deaths really plummet. If you look at the data, the deaths, particularly among, older people have, and that's what vaccines do. They prevent death among older people for the most part. So again, the burden of death is shifting, and it's shifting to poor places that can't afford to have so many vaccines, basically.
We also heard from Anthony Fauci saying that he expects the J&J shot to be restarted by Friday. We know that there are some issues with this one as well, of course, with adverse events being expected with all medications and vaccines. But what are the implications here for both the US and the rest of the world?
Right. Well, it's basically in the U.S., a trade-off between, safety and vaccine hesitancy, basically, or undermining the confidence in the vaccine. U.S. officials paused it because they said they had safety concerns. At the same time, when you say you have safety concerns, as with the AstraZeneca, vaccine, people are more scared to take it, and there's already a lot of vaccine hesitancy out there. But, it should be said, and this is, in some ways not a maybe nice thing to say, in some ways the U.S. can afford it because it has, a big pipeline of, Pfizer and Moderna vaccines in, and Johnson & Johnson makes up a relatively small portion, I guess about 10% of the U.S. vaccine supply. What that means for the rest of the world is that, there will likely be much more Johnson & Johnson for the rest of the world. It's a one-shot vaccine. Johnson & Johnson has tremendous capacities to, at some point, manufacture vaccines. So, in theory, maybe it's good for the rest of the world because if the U.S. doesn't take up these vaccines, they'll go elsewhere.